Admitting and discharging an asthmatic can seem overwhelming at first, but it is very protocolized with an asthma pathway and a checklist of items to complete on each patient admitted with asthma. In this video, we will review how to use the CRS score, an overview of our asthma pathway and how to use it, key points of the asthma admission order set, how to classify asthma severity and control, how to fill out an asthma action plan, and what needs to be completed prior to discharge. When you are examining an asthmatic, you first need to assess the clinical respiratory score. You must do this on your admission exam and on your follow-up assessments to know how they are advancing on their pathway. This is a CRS card. You should have it in your badge or in your pocket. Give a score for each category and add up the total. Keep in mind that the SpO2 reflects saturation off of any supplemental oxygen. The asthma pathway begins in the emergency room with their own flowchart and then transitions to an inpatient pathway once admitted. You can find copies of these pathways in the resident handbook. After your H&P, use the CRS you obtained to determine where the patient is on the pathway. Notice that the CRS drives the protocol. The CRS will determine how much albuterol to order for the patient on admission, and from there, the patient will wean per the protocol based on the subsequent CRS scores given by the respiratory therapists on their reassessments. Place admission orders use the asthma order set by selecting PED MedSurg Asthma. The order set opens up with several default items already checked. You will notice a consult to case management for home health already checked by default. This is ordered for every patient admitted with an asthma exacerbation or status asthmaticus. As indicated by the red arrow, some patients need a pulmonology consult. We consult pulmonology on patients with life-threatening asthma. This means patients severe enough to be admitted to the PICU, in which the consult should be initiated there, or if the patient had several admissions per year. You need to select this order and edit it, and you will need to call the pulmonologist during daytime hours. Most of the order set is already filled out for you. Here is the part where you need to decide where to start the patient on the pathway. If the patient has a CRS indicating continuous nebulizer treatment, edit this option and enter in the dose. If the patient will not be on continuous treatments, uncheck the box. If the CRS indicates intermittent albuterol via the inhaler, edit the second option to indicate how many puffs. You will also need to select dexamethasone for each patient, either liquid or tablet. The tablet is often better tolerated, and even young children can usually take this small tablet. The patient will need a total of 2 doses, including the one given in the ER. If the patient is admitted from our ER, pharmacy will account for this. If not, then you need to edit the order accordingly if dexamethasone was given at the outside hospital. Generally, if a patient ends up hospitalized for asthma, he or she should be started on an inhaled corticosteroid if not already on one. Decide how much to give based on your assessment of the severity and control, which will be discussed in the next section. If the patient is already on a control or medication, use the level of control to decide whether to increase the dose or step up the therapy. Finally, once you complete the order set, add separate orders for asthma education consult and any allergy medications if the patient needs them. When you admit an asthmatic, you need to classify the patient's severity and level of control. These are the charts you can use to classify the patient's level of severity of asthma based on age, as intermittent, mild persistent, moderate persistent, or severe persistent. This will help you initiate the therapy. This is a more specific way to classify the diagnosis of asthma. A copy of this chart is available in the resident handbook. Classifying the severity is important for the diagnosis and initiating therapy. Classifying the level of control using this chart helps you titrate the patient's therapy. The level of severity you give is an initial diagnosis and it does not change. Once a patient is diagnosed with asthma, the level of control dictates the type of treatment. These are the types of questions you need to ask in your H&P for a known asthmatic. A copy of these charts are available in the resident handbook binder. Also in the resident handbook is a chart indicating dosages of inhaled corticosteroids based on age. The discharge process for asthma patients is just as detailed as the admission. This box on the asthma pathway indicates when a patient is ready for discharge. As you can see, there are several criteria to be met. This is an asthma action plan. every asthmatic needs one, and every asthmatic admitted to the hospital with an exacerbation needs a new one filled out. It should be started at the time of admission and filled out early during the hospital stay. It must be reviewed with the parent prior to discharge. This is an important part of the management of asthma. It is an instruction sheet for anyone taking care of the patient at home, school, or daycare. Let's go through how to fill one out. Start at the top with the blue arrow. This is where you indicate the patient's severity of asthma and control based on what we discussed previously. With the green arrow, or the green zone, this is where you fill in the daily preventative asthma medications, such as inhaled corticosteroids and allergy medications. Also, if the patient has exercise-induced symptoms, fill in what to take 20 minutes before exercise, usually albuterol. Where the yellow arrow is the yellow zone. This is the patient's sick plan. When the patient is experiencing symptoms, start taking albuterol every 2 to 4 hours and list 4 to 6 puffs here. Also write, continue taking green zone medications as indicated above on one of the yellow lines. Where the red arrow is the red zone. The patient or parent moves into this zone if the yellow zone medicine is not helping or if symptoms are severe. List 8 puffs here and 2 in the blank where it says may repeat blank times 20 minutes apart. If the patient is in the red zone, they should seek medical attention. In the next section, you must list the patient's PCP and PCP's phone number. If an appointment is made, list it where it is stated, or state schedule follow-up appointment in 7 to 10 days with PCP. Initial one of the blanks indicating if the patient can carry and self-administer his or her inhaler. Generally, young children and young school-aged children cannot do this. Sign where indicated. You do not have to list a phone or pager number, but write the date and time. And finally, after reviewing this with the parent, have the parent sign at the bottom. After all of the writing goes through all 3 pages. You also need to place a pharmacy notification order to relabel the inhalers used here for home use. Otherwise, the inhaler, which often has a lot of puffs left, gets thrown away. To place this order, go to Orders, select the Meds category, and search for PHA as indicated. Select the pharmacy notification option and edit it. In the dose instructions box, write the relabeling instructions just as you would on a prescription pad. Be sure to do this as soon as you know the patient will be going home, if not before. This can take some time to get done and can delay the discharge. Finally, when you are entering the discharge medications, do not convert the albuterol used inpatient into a prescription. This is an option for medications listed on the MAR, but the inpatient albuterol inhaler is a smaller version of the inhaler that should be prescribed for home, and the patient will run out of it quickly if prescribed. Instead, go down to the section where you can enter new medications for prescriptions, search for albuterol, and select one of your options here.